Good afternoon or good evening. I'm glad that everyone could join us this evening for our webinar. And I'm so grateful for our two physicians that have joined us. I just want to say that this, in partnership with the West End Neighborhood House with Paul Calistro and the Wilmington Community Advisory Council through Gwen Angelette and Henry Smith, we are hosting this informational session. It is geared primarily towards the staff of community-based organizations, our partners in the nonprofit sector who have been on the front line in our community, particularly during COVID. You've been there to help people to make sure that our kids are still educated, even though schools were closed. You've been there to make sure that our seniors still had meals delivered and medications and the food they needed. You've been here to make sure that through the food banks and the lines and the stocking of toilet paper and hand sanitizers and all the things that our community need through those basic needs, you've been there. And if you may recall at the beginning, we worked collaboratively just to make sure that we had those basic PPEs, that you had masks, that you had hand sanitizers, that we were practicing safe and social distancing, but yet the community was still served. It was all about your safety. And tonight is about that too. As a vaccine is now available, we understand that so many people have anxiety. They may have reservations about it. And so we collectively, on behalf of the sector, have decided to host this information system to try to be able to bring more fact and truth to you. We want you to use this evening to hear from our two physicians that's with us, but it's your opportunity to put your questions in the chat box so that we can have real dialogue. We get it that you're getting noise from all over the place. You're getting it from Google, you're getting it from YouTube, you're getting it from the news, wherever you're getting your feed from. But this is an opportunity, right, for us to deal with myth and truth. I first want to start by asking you to take a poll. So we'd like to hear from you. If offered the vaccine today, would you take it? So I'm going to give you a couple minutes. If you could just answer this one question, yes or no. Again, if you were able to take the vaccine today, would you take it? Okay, so we said most have answered. So it says we're going to give you about 15 more seconds for those that are maybe trying to figure out how to maneuver technology. So thank you for doing that. I am pleased that tonight we have with us, wait, this is my screen. Sorry, thank you. Dr. Joan Coker and Dr. Velma Scantlebury. Dr. Joan Coker is a proud graduate of Tuskegee University. She completed her surgical internship at Howard University and residency at MLK Hospital in Los Angeles. And she's also a surgeon with ENT and allergies of Delaware. We also have with us Dr. Velma Scantlebury, who was recently semi-retired, a consultant, she said. But she also is the first Black female kidney transplant surgeon. She earned her medical degree from Columbia University in New York City. She was an intern and resident in general surgery at Harlem Hospital Harlem Hospital Center in New York City. And she completed her fellowship in transplantation surgery at the University of Pittsburgh and most recently retired from the Christiana Hospital System. But more importantly, these two ladies, they are committed to the community. Besides what they do professionally, if you don't know them, they give their heart and soul to making a difference in the community. They serve on many boards They serve in many leadership positions, all trying to really to enhance our communities. And I am privileged and honored to call them my friend. One wears pink and green and one wears red and white. And at this point, I'm going to turn it over to Dr. Joan Coker.
All right. We are so happy to be here with everyone. Thank you all for joining. We look forward to your questions. If you don't mind, on behalf of Velma and I'm going to start with just a sincere thank you. Thank you for your service to this community. We appreciate you. But if you don't mind, we're going to keep it real tonight. So we're going to have a real conversation. Let's talk about this vaccine and all that it means in this community. And we're going to have the answers for you. So load up the chat box. Let's get the questions going. And we're not going to waste time with a whole lot of stuff. We're just going to get to it. Dr. Scantlebury, you agree?
Absolutely. Thank you, Dr. Coker. I am excited to be here on this panel to answer your questions, to try to give you the facts and the scientific information so that you, hopefully, at the end of this session, will be more willing to receive the vaccine. It is something that we all need to do, and it's the vaccination process that's going to keep us from dying. The vaccine is no good without the vaccination, so you need to figure out if you are against it, what can we do to help you get there? And that's important because the information is out there. People are dying. We have over 380,000 people in the United States who have died from this COVID-19 disease. So this is real. We all know somebody who's been touched by this devastating illness. So it is important that if you have reservations, let us know. So we will get started with your questions.
So I'll just tell you this right now. So far from the audience, it jumped up, sorry, on me. I think it actually said 59% said yes, 16% says no, and 25% says they're unsure, just so you know for who we have in the audience. So the first question is, President-elect Biden says he's going to change the vaccine process so it's available, all of the first doses will be given without worrying about the second doses, so that the more people might get the first dose sooner. If that's true, then does the second dose really matter?
So when you listen to Dr. Fauci, and that's going to be our leadership tonight, there is no evidence that shows that one vaccine is effective and enough. So right now we are going with the 2 vaccine process. And Velma and I just got our second shot on Friday. Everybody's got a little bit of a sore arm, but you can anticipate, especially those that are younger, that when you get your second shot, you may have a few more symptoms, such as fever, fatigue, muscle ache, possibly even flu-like symptoms. But it doesn't last long. They're saying carve out about 48 hours after you've gotten your second vaccine. But right now, 1 dose does not seem to be enough.
And I have quite enough confidence in President-elect Biden that the goal here is that the hope is that we will get both Moderna and Pfizer to roll out X million more when it comes a month from now, or when he is now president and can approve these funds to get to that point. So it's important to get the first dose in, knowing that the second dose is going to be 3 to 4 weeks later. By then you can have at least 1 million more people. We don't have 1 million here in Delaware, but at least we can have a majority of the people vaccinated with what we have with the rollout for the average public in the summer.
Thanks. So next question, if I've already had COVID, do I still need a vaccine?
That's a great question. And that's the perfect question. And the answer is a rousing yes, because I think of the members on this call, everybody, possibly. I know we as healthcare professionals have seen folks that have gotten it in March, and then the next thing you know, they got it again in July. And I know one guy who just got it again, and the third time he got it, he was on a ventilator. So the exposure that you get from having the virus is not sufficient. It's not sufficient. It may give you on average about 90 days of immunity, but you certainly should get the vaccine, even if you've had the virus. That short answer is yes.
Yeah, and there are some people who have antibodies after the virus infection, but we're not testing people to see who have those antibodies. And we don't know if those antibodies are the same antibodies that you develop to protect yourself with a vaccine. So unless you just had COVID and you're still symptomatic and need to wait at least a month or two until you recover, then you should get the vaccine.
So Ms. Booker, your question that says, so after 90 days, what should you do? So let me be clear when I say this. Really, some of you that have had it, and it may have been a month, if your number comes up and you're called to come get the vaccine, you can get it in about 30 days. They're just saying there's possibly some immunity. So do you have to wait 90 days? Absolutely not. So if you had it in December and they call for you to get vaccinated right now, you get vaccinated.
There's a question there that says, I'm confused if you can still get COVID after the vaccine. The goal with the vaccine is that it gives you that protection, those antibodies that's going to buffer and defend your body like policemen is going to get that virus as it comes along. The goal is if you get exposed to that virus and you have those vaccine that cause you to get those antibodies, you will not get as sick. You may get a mild degree of but we're hoping that this will keep you out the hospitals, will keep you off the ventilator, and you will recover because now your immune system is now buffered to fight that corona, keep your other organs from getting sick. So you don't want it to invade your body. You don't want it to get into your kidneys and your heart and your lungs. And so the vaccine is there to help buffer that response.
I have one question in the chat that says, any insight into when we would know if this will be needed annually, like the flu vaccine, or will it be a one and done?
No, the jury's still out on that. And because this virus continuously mutates, as we can see it has done already, I think you should probably wrap your mind around for the first few years, we're probably going to need a booster annually. Yeah.
Right. Similar to the flu. Every year there are different flu strains, and we have to design the flu vaccine around the most common strains that are out there in the community. So same thing with this virus. I assume that it will be changing every year.
Yep.
There's one that says, it seems this vaccine rolled out super fast. I'm worried about safety protocols and research that typically takes years.
Yeah, that's everybody's deal. And I think the name was crazy. But the funny thing was the guy was just a Star Trek fan who came up with the idea of the name Warp Speed. But warped in the age that we've just gone through with this pandemic and so much misinformation and disinformation, it's got everybody upset. Yeah. But when you really look back at what the scientists have done, they've been working on SARS for, oh my God, 10 years, 10 to 15 years now. So all they needed to do was really develop the vaccine to the spike protein. So everybody's seeing that little molecule with the little red antennas hanging off of it when you look at the picture of the COVID molecule. So those little red antennas are called the spike protein. So they developed a vaccine to the spike protein. That's why you're not getting any live virus. I'm gonna say it one more time. You're not getting any part of the sequence of that virus. You're only getting what goes to the antenna, which is called the spike protein. So that's what makes it safer. And with messenger RNA, as opposed to DNA, you skip a step in the sense that there was an incubation period to weaken prior vaccines like the flu. We had to weaken it because we can't just give you the flu. So we had to weaken it or we had to kill the virus. And they would do that in the egg of hens, like literally hen eggs. Put it in there, weaken it, extract it, and then give it to you. We can skip that step because we're not giving you any part of a live virus. This is all just everything to the spike protein. Did you want to add to that, Velma?
Yeah, and you know, the whole concept of mRNA, that was developed years ago. The person responsible for the development of mRNA was actually in Philadelphia. She worked on this for almost 40 years. Moderna picked up her article in the early 20s, like 2005 or something like that, that she had published on mRNA, and everyone told her this was a dead end. Don't pursue it. Moderna was just a startup company, and they saw the potential of mRNA and they went after it. She also worked with Pfizer in terms of getting Pfizer, and but went back to Moderna. So mRNA has been a technology that's been around, just not known how to apply. And so this was a really big breakthrough to say we can use this for COVID-19 vaccine, because we've been testing it with other SARS virus. And so it was launched. All the framework was there. Money makes things move. Right. And what made this warp speed was that billions of dollars were put into getting through phase 1 and phase 2 trials, which generally take months to years to get there. Once the money is thrown out there, you can recruit people, you can pay them, you can pay your staff to follow people and to get those tests in place for those 70,000 people who went through phase 3 trials to get to this point.
So here I'm going to double these two questions up, right? It says, why is it important to get this vaccine? I don't even get the flu shot. That was one, right? And the second one is, once you get the vaccine, how long does it take to become effective against COVID-19?
So why you should get it is because of the number of people that are dead. Let's just be clear. This virus will kill you. And in every single person, it responds differently. You've got a 17-year-old who can't breathe, and you've got a 90-year-old coming out after 5 days of being in the hospital in a wheelchair, waving his or her hands. So you just don't know what your story is going to be. So what you want is a weapon in the toolbox that says, if I get it, the likelihood that I'll need a ventilator or a prolonged hospitalization is less. Everybody who knows me knows my favorite phrase is, this is not pixie dust, okay? I have no pixie dust. You're still possibly going to get COVID, but will you live? The likelihood is much higher. So once you get vaccine number 1, you'll have some immunity. They're saying somewhere around 50 to 54% immunity. Once you get vaccine number 2, you have a greater than 90% chance that you have immunity, but it's going to take 2 weeks after vaccine number 2. So with Moderna, you're going to get your second shot 28 days later. With Pfizer, you're going to get your second shot 21 days later. So it's either 3 or 4 weeks. And then the next 2 weeks, you should have the immunity that you need to live. I don't get the flu shot. So I'm going to keep it real. I don't get the flu shot. I eat healthy. I take vitamins. I typically don't get the flu shot. I got the flu shot this year because the last place I wanted to be was in the emergency room of the hospital. So I got my flu shot this year, and I got vaccinated because I can't live like this. And I don't think you can either.
And it's not just about you. It's about the people around you. It's about your community. It's about who you're going to spread that virus to if you choose not to get vaccinated, and who's going to die because you chose not to get vaccinated, if not yourself. So it's about looking at the risk benefits. What are my chances here? So not think outside yourself and think about those around you.
That's right.
Is it safe to take if I suffer from allergies?
Oh, yay. Somebody finally asked the allergy question. So we do a lot of allergy in our office. In fact, we do 1,000 shots a week in our office. So we see everybody from the most severe allergies to those that have had reactions to vaccinations. So let's be clear. Those that had an anaphylactic reaction are those that have had reactions to vaccinations in the past. So if you're allergic to crab and fish and grass and trees and mold, and even if you're on immunotherapy, you can still get the shot, and you should get the shot. But what you've got to be careful about is where you get the shot. So you're not rolling up in Walgreens if you've got severe allergies. You're not rolling up in Rite Aid, not to discount them. You want to be in an office where everybody can watch you and they are prepared. Now, no one who's doing the vaccinations is supposed to be unprepared. But I think you would feel more comfortable if you were in a site that constantly treats anaphylaxis. So allergy practices, your primary care physician, those in the emergency room, urgent care centers, that's where you want to be. And as opposed to the 15-minute wait time, you may need 30 minutes. So just go where you're comfortable. You're not driving through Walgreens and getting a vaccine if you have severe allergies. It's not a smart thing to do. That's my opinion.
And what one of our physicians did herself is that you check the ingredients within the vaccine, talk to your doctor about it, check to see if any of the ingredients in the vaccine is something that you might have been allergic to. One of our physicians who had an anaphylactic reaction to a medication, she checked it. They told her she was safe. She took it with us. She waited 30 minutes and she did just fine. So even if you've had previous anaphylaxis, it may not be to the same ingredients. So those things are what you want to check out before. Talk to your doctor, make sure it's safe for you.
Is it a valid concern that COVID-19 may have side effects later on in years from now that haven't been studied yet?
No question.
Yeah, absolutely.
It's as bad as 9/11.
Yeah.
And people are already having what they call the post-COVID syndrome. And they're setting up areas like Penn, Jefferson, NYU to really look at, because some people are just out of breath, out of gas, can't get their energy back, can't get their smell and taste back, which we see a lot in our office. So folks are worried about the side effects about a vaccine that has no live virus in it. And I'm going to tell you, redirect your concerns with how you'll feel should you get COVID. That's where your energy needs to be.
And what I tell people, when you think about losing your sense of taste and smell, those are neurologic. That comes from the brain. That comes from your brain stem. So if you think about it, you've got COVID already invaded into your brain. People get kidney disease, end up on dialysis. People get liver failure, blood clots, lose their limbs, lose their legs, die. So there are those who are called long haulers who suffer the consequences for very long and are debilitated afterwards. Those are conditions you need to consider. Do I want to get there?
Correct.
Do I still need to wear a mask in public after being vaccinated?
100% yes.
Absolutely.
Yes. I'm going to say it again. This is not pixie dust. And until we get to herd immunity, which is about 70% of the state of Delaware immunized, we're going to wear our mask. Yep. It's not time to let it down. You may be good, but you've got to protect others from you and protect yourself, because you don't want to get it in any form, even though it may not be as severe for you. So yes, please still wear your mask.
I saw there's a question in there about pregnant women, and I've seen both sides. I follow some friends on Twitter who got their shots. She was 6 months pregnant. She was high risk. She wanted to protect herself, and there's others who do not want to do it. So the best thing is to talk to your doctor about it. Find out what category you're in. What are your risks? Because COVID during pregnancy can also be very, very devastating. So if you're in a position where you can isolate yourself and keep from that exposure, you want to discuss with your doctor the risk benefits to you as someone in pregnancy of taking the COVID vaccine.
Right. And I'll just add to that, some folks that were in the human phase 3 trials got pregnant after getting their vaccine, and they did fine, had no problems. But they got pregnant during the trials, the human trials, and they did fine.
It says, does the vaccine prevent me from spreading COVID if I get it?
Unfortunately not. That's why we still got to wear our mask, guys. That's exactly why we still have to wear our mask, because you can still get it. It may be in a very mild form. And just look at all the asymptomatic carriers. Like, for instance, we did 35,000 tests at Delaware State University from August to Thanksgiving. And we had several students, always less than 1% positivity rate. But of those 79 students, only 2 presented with symptoms. 2. And they had levels of viral titer that if they had just sneezed, they could have taken out an entire congregation at a church. That's how high their viral titers were. But those kids were absolutely fine. And if we hadn't told them they were positive, they would have never known. So you got to be very careful. You got to continue to wear your mask, because even a small amount can still take an elderly person or an immunocompromised person out.
Yeah.
Good question.
Is there any information about fertility in women who are pregnant or trying to become pregnant?
I don't think so. I don't think there's enough data on pregnant women to really offer that information, except for those few who were in the trials. But again, all this is something you have to remember is the effect on the immune system. and what your underlying conditions are, it will probably play more of a role in terms of fertility. We don't know enough about it. We have to remember these vaccines are under emergency authorization because of the death rate. So they're not fully approved as in across the board, but only because of the devastating deaths. So truly, we don't have all the data, but we know that unless we do something, if we wait 6 months to get this vaccine approved, we will probably have another 500,000 people dead. Yes. So getting this vaccine out there is important, but we know that there's also going to be issues that we don't really have enough answers for.
Yes.
Will your primary physician be giving the vaccine? Yeah, and I think there was another question, sorry, tagged with that. People wanted to know, I'm 75, where do I go to get it?
Yeah, so Delaware is starting to ramp up. We just got some dosages in our office. And so we're very excited to be a part of the vaccination plan with ENT and Allergy of Delaware at our Iron Hill office. So what's happening is doctors' offices, urgent care centers, everybody's just getting their vaccine. So right now we're still dealing with the healthcare population, but as soon as that's done, we're going to move into 65 and up. And you're going to look, because it'll be very similar to signing up for the COVID test. So you'll register online, find a place where you're comfortable, and then we'll be all set to go. So you don't have to be a patient in my practice to get a vaccination, okay? But we're not there yet with 65 because we're still trying to manage the healthcare professionals so far. So we have to do with the Department of Public Health mandates right now, and we're still at the extended care facilities or the long-term care facilities and healthcare workers. But we're moving very quickly into the next group. So you got to listen out for the news, read your emails that come from the Department of Health, and stay ready. And Michelle, you guys do a great job with getting information out to the public. So we thank you and Gwen Angelette and the entire group for all that you do.
Yeah, one of the questions that was put to me by several in my community is, how do we get the 80 and 90-year-olds over and vaccinated before the 65-year-olds? Will there be a plan based on date of birth or and not so that they don't get left out? Because over 65 is a whole bunch of people, but why not gravitate to the older group? So I really want to know for our community, wants that plan, and I know that for those over 65 is sort of earmarked the last week in January and rolling out to February. So I hope there will be a sort of specific plan to get those patients, residents in there. Some of the doctor's office, like my primary and other physicians of color who have applied to give the vaccine, have not gotten a response. So I'm really disappointed with that. So I'm hoping that there will be a plan for the public to know where they should go.
Yes.
So the question is, what happens if I do get a bad reaction to the vaccine?
Oh, we're going to take care of you. You're going to be at a facility because as fast as they give you the vaccine, they also hand out, I'm talking about the Department of Public Health, the entire protocol to manage a reaction. So if it's a delayed reaction, you may get a little sick. So prepare in your mind, those first 48 hours may be a little rough for you, but most of the patients, the 30,000 that have participated in the study, it only lasted about 48 hours. And it may have been like flu-like symptoms, a little achy, maybe a headache, a fever, but that's your body responding. So it's really not the worst thing. It should give you comfort that you reacted.
Yes.
Please understand that. That's a good sign. It's not a bad sign.
So I'm just going to remind those that are here this evening that if you are working in one of the child care centers providing learning pods or services to kids, you are included in the 1B timeframe for vaccinations. So any idea when children may be able to get vaccinated?
The children were not in the trial. Moderna and Pfizer, it's 18-year-old and 16 is probably the cutoff age. There were some in the trials that were 12 and over, but not enough. And so the issue is this safe for children? We don't know yet. And so with children specifically targeted during in a trial, it is so far we're leaving them up to somehow get herd immunity, but there's no indication as yet that it's safe to give to children.
Yeah.
Is there any reason for me to get tested before I actually take the vaccine?
No.
No.
Nope.
Unless you think you're sick. If you feel you're ill and have symptoms of something else, and you feel like maybe you are coming down with flu-like symptoms or something, you don't want to get the vaccine while you have a sinus infection or any kind of other infection. So you want your body to be able to distinguish, and they want to make sure that your side effects are not due to what you already had versus versus the vaccine which you received. So it's important if you're ill, don't get the vaccine during that time.
So there were questions about the differences in the vaccines that's available. Should seniors take one more over the other? And someone wanted to know what's the name of the one-shot vaccine and why don't we just use that one?
So the difference between the Pfizer and the Moderna is pretty much, just imagine, many of us grew up watching the Jetsons. And remember, they used to fly around in these little bubbles. So imagine that the vaccine is in a bubble, because it literally is a lipid bubble and the vaccine is housed in it. So depending on the contents of your bubble, that determines how fragile the bubble is that's transferring it into the cell, not the nucleus.
It's a fat goblet. It's just a little fat,
yeah, just a little fat goblet is where they put it just to keep it safe, to get it where it needs to go, to get that message to say, make this protein react when you see this guy on the street. Right. So the bubble for Pfizer is a little more fragile in the sense that it has to be stored at like -80, -90 degrees. When they thaw it, you got 5 days to get that vaccine out. Moderna has a more stable particle. Is it a better vaccine? Not necessarily. It's just a bubble that's a little different. So it's just the mechanism. So both of them do the exact same thing, but everybody's in their own little bubble. And so their bubble doesn't require as much. And once you get the vaccine there, you got about 30 days to get Moderna out. So Moderna is going to be awesome for like Indian reservations and places that are very remote. But we got the Pfizer vaccine, but I can tell you, it doesn't matter to me whether I had gotten Moderna or Pfizer. I would have taken either one that they have. But once you get one, you got to stick with that guy, because that's going to be your second dose. You're not going to start with Pfizer and end with Moderna. Now, as far as the one and done, they're still doing research on that, but that is what you need to know is that is one, and correct me if I'm wrong, but that AstraZeneca is a DNA model, and it is a little part of the virus. It's weakened, but it does have a little part of the virus in it, and that may be why it's just a one and done.
But it's also not approved by United States. Is it, they distributed it in United Kingdom. Mm-hmm. As far as effectiveness, when we look at efficacy, is not nearly as effective. It has more like a 70% effectiveness versus the 95% of Pfizer and Moderna. So even though it's a one shot, the USA has much more rigid rules about passing vaccines through the FDA, and it has not been approved. So don't get too excited until we see the results of those trials and get really passed through the rigors of our FDA process.
Correct.
What happens if I have a couple of questions on here about people with illnesses that cannot take the flu shot? And the question is, should they take the vaccine?
Again, it depends on why you can't take the flu shot. If you're allergic to eggs, there's no eggs in these vaccines. If it's something within the chemical makeup of the flu shot itself, again, it's looking at the ingredients that are in there, and there are really no preservatives in these vaccines. Mm-hmm. So that's why they need to be frozen. And so just looking at I think for both of them, it's mostly like a sugar molecule that called sucrose to deliver and stabilize it. So you really need to talk to your doctor about what's different, what caused your allergies, and whether or not you feel it's safe. But your standard allergies, as Dr. Coker would say, well, it's medication and food, all those really don't make a difference.
Yeah.
So it says, what are some of the strategies you're seeing as healthcare professionals trying to connect the vaccine education and advocacy to the community that do not trust the vaccine and also don't have a traditional relationship, right, with their doctor or with historical healthcare workers?
Yeah, that's the problem. The problem, and we have to acknowledge that in this country, is we have a rich history. We have a rich history of experimentation, especially experimentation on people of color. So I will tell you that before the election, I was one of those like, you can have my spot. I'm good. Nope, I don't. I'll wait. I was that person. When the scientists didn't release the information before the election, I knew again that science mattered. Yeah. It restored my faith that science mattered. I think the messenger is critical. So it's going to take those of us in the community, when you know that we care, nobody's selling you a bill of goods, nobody's profiting off these vaccinations. We told them we don't need any money. We don't even need staff. We're going to volunteer. We'll come in on the weekends if we need to. Doesn't matter to us. We just want to get our state on the right side of history and get our folks back to work and doing and living like we used to live. So we get it. First, we got to acknowledge that there's a problem with misinformation in this country. Let's acknowledge that there's a problem with experimentation on people of color. And once we acknowledge that, but what I'll say is not only have we had a seat at the table with this vaccine, we have been leading with this vaccine. Kismakia Corbett, her name is Dr. Kizzy. She was on the front line of this. She is one of the key people with Moderna. The NMA, I'm so proud of the NMA, the National Medical Association, has been at the table with every single step of this, making sure that we are a part of the study. Moderna even slowed their process down to bring more people of color in to make sure that if we got it, we would all be okay. So the science has been done. And folks know that it's important that we get it right. We got to get it right this time. And I will say they've bent over backwards to make sure that we have. And I appreciate that.
No, when you have anything. So there are some questions too about what advice would you give to the audience tonight around friends and family members who just refuse to take the vaccine so that they can encourage them to do so?
You know, COVID kills. The bottom line is you're risking your life, not just your life, the lives of those around you. So it's not just about you when you refuse to take it. And I'll tell you a personal story about my brother who thought he had the flu and refused to go to the hospital, refused to get tested. And everyone's coming over there. I was like, you guys got to stop. And before you know it, not only did he have COVID, it ended up in a blood clot in his lungs, dehydrated, hospitalized for over 10 days. But my sisters, my brothers, his grandson, they all got it. And so now you have put other people at risk. And so that's the issue. You may die just because you selfishly decided you don't want this vaccine. So they need to realize, I used to tell my patients, if you are willing to take that risk, if you still want to go to the beauty parlor or hair salon or go out to eat and not wear your mask, make sure you have your will all taken care of, because you're risking death. And so it's not just about you. Think beyond yourself, I think. And that's, for me, it's like, that's being selfish. So that's my reaction.
I agree, Velma. And I'm glad you shared that story. You know, I'm looking through the chat as we're talking, and I see people saying, what if I have MS? What if I have diabetes? What if I've had cardiovascular disease? What if I've got high blood pressure?
What if I had a transplant?
What if I had a transplant? We got Velma right here. So here's the thing. Because this is not a live virus, no part of the COVID virus, only that spike protein, the likelihood that you are safe is much greater. Did they have a whole bunch of folks with MS in this study? Probably not. So that's why it's going to be important that you talk with your physician before you consider it, but also be in a place that's comfortable for you and that you know if something should go left, they are prepared to help manage me. So that comfort level is critical because you can drive yourself crazy with this whole thing. So make sure that you're not sitting up in a place where, I'm not too sure they're going to be ready if something goes down. No, you need to be at a facility that you believe in the folks that are there and you know that you will be taken care of. And that may take a little bit of a search, but that's where you need to be, because that's half the battle right there, is believing that you're going to be okay if something happens.
Yeah.
And then the question was, did anyone die during the trials?
Not that I'm aware of.
No.
Not related to the vaccine. I know post-vaccine, there's one physician, I think, who was in Florida that reported some died. He developed skin rashes and spots all over his body 3 days after the vaccine. They weren't sure what was going on with him. He actually had a bone marrow disorder where he lost all ability to make platelets, and whether that was due to an underlying disease or something he contracted before he got the virus, he subsequently passed. But so far, there's no information that has been released as to whether they think it was related to the vaccine or not.
Mm-hmm.
How does the current vaccine stand up against the new strands that they're speaking about in the media?
Oh, they're feeling optimistic. They're feeling optimistic because the thing is, because it's the spike protein and there may be a little variation on that spike protein, they can always keep improving, but they feel that right now we've got enough immunity that even with the new strain, you will be safer if you are vaccinated.
It's sort of like the flu. We know there are many different strains of the flu, and the flu vaccine can protect us from the 4 or 5 strains they put within the flu vaccine, but you may still be exposed to the flu and may get sick from another strain of the flu, but you may not get as sick had you not taken the vaccine. So the goal is the whole nature and the bulk of the molecule of the SARS virus. The genetic makeup is not going to change 100%. It may be altered in a small degree, but the bottom line is that vaccine, that mRNA genetic information that's passed on to us through the vaccine allows your body to make antibodies, those policemen that protect you no matter what variant of the mutant virus your body gets exposed to.
Yeah, somebody may have joined us late and they said, what's the spike protein? So when you look at the COVID molecule, when you're watching the news and you see all those little red antennas hanging off that little ball of the COVID molecule, that's a very real description of what COVID looks like under the microscope. So those little red antennas, those are the spike proteins. That's real. They did a great job with that.
It says, someone says they're comfortable with taking the first shot dosage, but they're not as comfortable with the second. They're on the fence because of that. Is there something that you guys can share about the second dose?
You need the second dose. Let's look at it this way. You have a 2-step hurdle to get to the goal line. Getting over the first hurdle, that once you jump the first hurdle, it's going to give you enough booster and strength to get over the second hurdle to get to the finish line. So if you just go over one hurdle, you don't win. You just get yourself geared up enough, but your immune system needs that second booster to really get get immune system just revved up to 95% of those antibodies. So it's like you get your first troops came out with the first dose, but they're not strong enough to really defend your body's immune system. And that second dose is like, bang, we want 1 million more troops, 1 million more antibodies being formed, so that protection, that's your lasting protection. That's where your memory cells are geared up, and those memory cells are able to remember and store that information so that down the line, months down the line, you're still protected.
And why does the second dose seem to bring on more symptoms? And the second part is, why is that more frequent in younger individuals?
I think it's your immune system is more robust when you're younger sometimes. And so therefore you have, just like you tend to get more lymph nodes and different, when you have a cold, you get some swelling in your neck. That's your body's response to that foreign entity that you just saw. So the goal is that once you've been exposed to it the first time through the first part of the vaccine, your body has stored memory cells and it has reacted to the presence of the mRNA, and it's building its building blocks, but it's not quite there yet. The second dose is giving you that second exposure, which now your body has been exposed the first time. And so now you have a stronger response. So those symptoms you're getting is a good response. It means your body is turning out those lymphocytes, those protector cells, those antibodies, those cytokines that says we are ready. And
Yep.
so the stronger your response is, it's more likely that you have a more robust immune system, and therefore you're more geared up. I'm more worried about the fact that I got 2 doses and all I got was ache in my arm. I'm worried about perhaps I didn't build a stronger immune response. And maybe my body, as now that I'm older, isn't reacting as well. So having that reaction is a good thing.
Yes.
And I think that confirms, and can you confirm that there is possible that you don't have any reaction or a minimum reaction to the first dosage, but you could definitely have a more severe reaction to the second?
Yeah, I was totally prepared to really be sick for the second dosage, and I was fine. Same little achy arm, like Velma. I was almost disappointed that I didn't get anything. I was like, oh, I mean, I had a slight headache, but that was it. One Motrin and I was done. So yeah. I just like she is, I was a little concerned that I didn't have more of a reaction, because I was hopeful to have a little more.
What do you think about conspiracists who think this is just population control?
I think COVID pandemic is more population control. I don't think who put that out there. Look at all the people who died. I mean, you couldn't have asked if we had this amount of people who died from 9/11 or the last World War, or in Afghanistan, we would be just calling Bloody Mary, because it's just an incredible amount of people, even just here. So thus, this is a pandemic of beyond proportions.
Yes.
Other than from the Spanish flu. So,
right. And that whole, there's a computer chip in there that's tracking me. Nobody needs to track you with a vaccine when you won't leave home without your phone. Are you kidding me? Come on now. You will turn around and go all the way back home and be late for a meeting because you left your phone. So nobody needs to put.
Uncle Sam is already checking. You're right in your iPhone.
Because your phone is always on and always charged. So we thank you for that.
So we're still getting questions even up to the last couple minutes that you saw. If you could just re-clarify again, when will seniors be able to get the vaccination? And then if you could still clarify, we're still getting questions about children.
Yeah, children, it's going to be a minute for the kids. But I will say seniors, everybody who's 65 and older, stand by because it's coming soon. I think by the end of the month, if not sooner, you all will be in line for vaccination. It's coming very, very soon for 65 and older.
Yeah, and I have challenged Dr. Rattay to really lay out a plan so that people know where to go. They're not confused. They get the forms in advance. Is there a way they could fill out those forms in advance? Is there a way to register, either by zip code or by date of birth? And I think that just sort of knowing that information would sort of put people at ease. Yeah,
and the herd immunity is the concept that the majority of the population, and the magic number seems to be 70%, then we can maybe, as Dr. Fauci says, kind of go back to normal living, if you will. So you may be able to relax the mask. You may be able to, travel without a whole lot of fear once we get to about 70% of the population immunized.
And do we know what that percentage is today?
No. I don't think we followed the number of people.
We got like 9 million done. And we're not, what are we at? 1%? Not even 1%. Oh, we're nowhere near where we need to be.
Would it be beneficial to increase your immune system through vitamins and et cetera first before getting the vaccination? And if so, would you recommend it?
Always. Absolutely. I'm never going to say no to that. Always, always, always. Do everything you can. If you stay ready, you don't have to get ready.
Yeah. Take some vitamin C, make sure you get your vitamin D.
Yes.
All that's good in general to help your immune system be more robust.
For sure.
What's the best source of information on the vaccine for people to go to?
I'm going to tell you, I spent a lot of time on YouTube, and I do a lot with blackdoctors.org because I want to hear what some of the other physicians are saying, because they really have the scientists that have been a part of this process from inception. But really, there are a lot of science teachers that are on YouTube that really break down this whole vaccination process. And it's brilliant. I mean, little kids could understand it. I've watched quite a few of them on the messenger RNA because it's a brand new concept. The funny thing is we should be celebrating in this country, just like we should have celebrated, well, I won't go into that, but we should be celebrating the messenger RNA and that this was something that was done in this country first. It's monumental. And the fact that you have skipped an entire step and you don't, because it's not a live virus, so you don't have to put it in the egg of a hen and you can manufacture it very quickly and it's a better immune response. Somebody needs to win a Nobel Prize and we're all sitting around talking about, I don't know about this one. This is incredible, incredible science.
And I want to say, I take my hat off to the scientist who, I forgot her name, from Pennsylvania, who came over here from Poland, I think it was. This has been her main agenda for the last 40 years. Got no recognition for it. Everyone told her it was a dead end, but she knew there was something to this mRNA. And I hope she gets the Nobel Prize because this is a tremendous breakthrough. And it also is going to create and open doors to so much more in terms of the medical profession, more vaccines, cancer treatments, all those things will be definitely improved upon because of this mRNA process.
Correct.
Believe it or not, we're coming up close on the hour. We do have one question. We have maybe two more questions before we begin to close out. One, do you know when the 50-something-year-olds will be in line?
After the 60-something
children at home.
After the 60-something-year-olds, of 65 plus, I think the 18 to 64 will be the more of the spring rollout. Mm-hmm. You're looking more at probably April, I should say. Okay. But it all depends. Check the Delaware website. Keep looking and checking for information from the Department of Public Health in terms of what phase you're in from that standpoint.
Right. And then the last question is, should we schedule appointments with our doctor to get the vaccination? I think people really still want to know, like, how do they get it? Where do they go?
Yeah, I think on the Department of Public Health website is where you can find out which physicians are participating. I know that our office we only got a small amount in and we're still dealing with healthcare delivery, but many, many offices will be receiving it very soon here. So you can call your doctor's office, but the better thing to do would be, just because so many people are still really sick right now and calling for appointments, if you're looking for the information, just go to the Delaware Public Health website. And perhaps you guys even have a website at United Way where they can get this information. That would be great.
Yeah.
Well, I want to thank Dr. Joan and Dr. Velma for joining us this evening. In the words of the last person here, says, thank you for this real talk, all in capital letters. There's a lot of comments in here that people are thanking you for your time and for keeping it real. Before people leave, we do want to do the post again. If we can put up the question, we'd like to know again, if you were offered the vaccine today, would you take it?
Come on, guys. Come on. Come on. We got to get better. We got to get to living. We can't live like this.
Those that were unsure, we really want to see where you...
Yeah, that's the unsure part. Those are the ones.
So if you were offered the vaccine today, would you take it? I also, while you're filling this out, I want to be able to say this is not the end. We will be continuing to work with our partners, Western Neighborhood House, the Wilmington Community Advisory Council, Boys and Girls Clubs, Children and Families First. A lot of our agency partners want to make sure that we're bringing you information, that we are ensuring that particularly our frontline essential staff are protected and that you are making good choices. I can speak for myself. While not a physician, while I have been working to ensure that we stay safe as a community, I plan to take the vaccine because I believe it is the best way to protect myself and my community and my family. And I hope that you too will feel that way, or that we can eventually continue to bring information to you. So if you also want to be a part of continued conversations and dialogue, put your name and information in the chat section so that we can make sure that we follow up with you. We will also try to make sure that we connect our websites for public health onto the 211 website, to the West End Neighborhood House, to 211, to United Way, to Wilmington Community Advisory Council, so that information is readily available. And a few of you wanted to know, were we recording and could you have access to this? We will also make sure that that information goes out to all of you, that we have your email. But in addition, we will post it on the 211 website, West End Neighborhood House, United Way, Wilmington Community Advisory Council. And I think we talked to public health about doing the same thing. And so I just want to thank again, Dr. Joan and Dr. Velma, for spending time with us this evening, for all of you to taking time out to come and to be to hear more. And Matt, do you have results for us? You have any new results that we can see if we shift it?
And if you're still a no or uncertain, email me or Dr. Joan.
Yeah. Call me, because you know I'm going to talk to you.
Okay, so here's what happened. We jumped up to 78% said yes. Only
Let's go, Delaware.
No, and now only 12% are unsure.
We'll take it. We'll take it.
We will take it.
Awesome.
A lot of people are putting their names in the chat section and saying they want to be engaged with helping us to be able to spread this information in the community. So again, go ahead. You want to say last thing? Sorry, before I close.
I just want to say this. You guys, Gwen, Henry, Michelle, you guys are doing an awesome job. And thank you everybody for even taking the time to listen to us. I promise you, we are not taking you down a rabbit hole. We are literally trying to get you back visiting with your elderly folks in your family, keep the kids safe. Let's do everything we can, get these kids back to school, get these teachers vaccinated, so that we can just literally start living again, get back to living.
And because we cannot vaccinate the kids, if the adults get vaccinated, we will not be communicating that virus around so that our kids can end up getting it and taking it back home, because they will be already, the adults in their home would already be vaccinated. And that's how we control this virus infection, this pandemic. So get vaccinated. We've got to save each other.
That's right.
And that's our closing note. So get vaccinated. Good evening.
All right. Thanks, everybody.
Thanks, everyone.